Okay, this video is called Sunlight and Red Light and Infrared Light for Treatment of Parkinson's Disease and Cancer. Okay, so here's what I'm talking about. Glenn Jeffrey, the scientist from England University College London, showed that when sunlight or incandescent light bulbs shine on a person, they give off red light and near-infrared light, NIR, near-infrared light. Red light is in the ballpark of 670 nanometers peak wavelength. Near-infrared, about 850 nanometers peak wavelength. Visible light only goes up to 700 nanometers. The point of all this is that these wavelengths are long wavelengths as far as light is concerned, and they will pass through the entire body. You can put a photodetector plate posterior to the patient, and they will pass through the patient. Some of the light will be absorbed inside the body, inside the mitochondria, and it causes increased mitochondrial function. The mitochondria are able to make more ATP. It's thought that they fluidize, they make less viscous, lower the viscosity of the mitochondrial matrix fluid that is near ATP synthase. Remember that there's 4 phases of water. Everybody knows liquid water, everybody knows ice is solid water, vapor is gas water, but the 4th phase of water is a gel. And the idea of a gel is, think about it. If animals are, 60-65% water, how come when we get a cut, we don't bleed water? How come when you crack an egg, you don't get water out of it? Because it contains the water is mostly in a gel form, like when you crack an egg. Okay, so anyways, to activate different parts of a cell, you can fluidize those segments, and then the enzymes in those locations can move more rapidly. So you can produce more ATP. And this is actually a very big deal because light is free. The unique thing about incandescent light bulbs is they produce a lot of light in the red and the near-infrared spectrum. And that is very different than LED lights. LED lights, light-emitting diodes, they typically only produce light less than about 620 nanometers, which means they don't have this beneficial effect on the mitochondria. They actually have a harmful effect on mitochondria. So the point is, mitochondria is where your energy is made. Sunlight and incandescent light increase your energy levels. That's what you need. That's what your immune system needs to fight disease. That's what your regular cells need to prevent disease. So this has a theoretical benefit. It has not yet been tested for the treatment of cancer patients as far as I'm aware. It has not yet been officially tested on Parkinson's, but it makes complete sense. And I've also noticed lots of these multi-decade survivors of cancer. Where did they go? Dr. Day, living in California, hot sunny climate. Ruth Hydrich, living in Hawaii, hot sunny climate. Okay, who's the other one? Janet Murray, living in Australia, hot sunny climate. They got out a lot in the sun. Okay, they walked around, exercised a lot in the sunshine, so they were getting this effect. Sunlight itself has a very wide spectrum of light. Okay, it goes all the way up to 2,500 nanometers, and most of it is red and near infrared. It's over 50% of it, about 54% of it. So it gives you the good stuff. We're made for this. Okay. I'll show you a couple more slides of what this is all about. Incandescent light bulbs, they're cheap. You can just buy them off the internet, and they're what's unique about them, all the stuff on the label is kind of not as helpful as you'd want. You want to know the wattage, but they tell you the cost, but they don't tell you the wavelength of the light. But just because you know it's incandescent, that's what you need to know. Okay, now here's an example of the light spectrum. So down here are the short wavelengths like violet, and over here it's not on the film. These are all the visible lights. Ultraviolet, which would be over here, is invisible to the human eye. Okay, now here's the longer wavelength lights, and red light is still visible, but once you go beyond red light, then you're in the ballpark of near infrared. So it's near to being like red. Okay, so the most common wavelength used in these experiments was about 670 nanometers as a type of red light. For showing near infrared light, most commonly used spectrum has been wavelength has been about 850. Okay. Now here's another example of what these light spectrums are all about. Here's an LED light bulb up here. Notice in the LED light bulb, there's tons and tons of blue. You don't want that. That mimics daytime, but the problem is they actually take these and they will shut off these higher wavelengths in LED lights, so you're getting almost entirely blue, and you don't want that. Okay, the reason is that actually decreases mitochondrial function. whereas an incandescent light, like this right here, gives you a lot of red light and near-infrared light. So that improves your mitochondrial function. Incandescent bulbs are good. I bought them myself. Once I read all this stuff, I'm like, holy crap, that's what I got to do. And I bought them. And I can tell you, the best researchers, Glenn Jeffrey and brilliant sleep scientists like Dr. Roger Seahold over at MedCram, they go with incandescent light bulbs. There's a very good reason for it. Once you understand, you're going to want incandescent light bulbs. Okay, now here's what I was talking about, the mitochondrial approach to treat Parkinson's disease and cancer, as well as other diseases, because lots of diseases are due to an energy crisis in the cell. The cell can't make enough energy to fight off its problems. And look at these typical diseases. Diabetes type 2, it's due to mitochondrial inhibition. Parkinson's disease due to mitochondrial damage and inhibition. Chronic fatigue syndrome. Supply and demand neuronal degeneration. The Peter Rogers MD theory of dementia. Okay, the best theory. All right, so sunlight exposure outdoors does lots of good things for us. Increases vitamin D, increases nitric oxide precursor releases. But that's due to the ultraviolet light component of it. That's also where you get a suntan from. The improvement in mitochondrial function is due to the infrared light. Incandescent light bulbs are basically like sunlight. Think of incandescent light bulbs and sunlight as being essentially the same. They're not exactly the same, but they're essentially the same for our purposes. Now, there is talk about red light therapy, but that hasn't been standardized that well yet. I think it has a lot of potential, but a lot more research needs to be done to figure out what's the dosage, what part of the body to expose, and how to handle it. You should avoid mitochondria inhibitors. I'm the one who figured out there's like over 120 of them, and I've listed them all. I put them in my books. I put them in my lectures. I got lectures on this YouTube channel. I got a good lecture on mitochondria over at VegSource if you want to see it. So you want to avoid all those things. So basically, avoiding processed food, filtering your drinking water, being careful about what medications you take. Those are the best ways to avoid them, okay? Avoid SERCA inhibitors. Anything that smells bad will often be a SERCA inhibitor, okay? Eat the low-fat, low-sodium vegan diet with no oil, no caffeine, because that optimizes blood flow delivery to the tissues, providing more oxygen. Reverse osmosis water filter to get rid of fluoride and aluminum, because those are mitochondrial inhibitors. If somebody was really sick, I would remove the dental amalgam silver fillings because they contain mercury, which is a mitochondrial inhibitor. So you want to really, give your body a chance to handle things by optimizing mitochondrial function. I would just extract the teeth. That's what I would do if I was, in a serious disease situation. Okay, exercise. When you walk, you increase flow through your lymphatics. The lymphatic system has just been described as a sewer system of the human body. And its flow depends on muscle contraction. So that's what you need to do. Improve your sleep as much as you can. I've made videos about that, and I'm going to make another one real soon. Optimize your sleep. Lower your stress as best you can. Have a good sense of purpose in life. Religious people are a lot healthier. No caffeine, it's a vasoconstrictor and it thickens the blood with hyperlipidemia. I like grounding pads. Again, I don't know for sure how much they work based on placebo versus effect, but theoretically they increase negative ions in your endothelial glycocalyx and they're supposed to be helpful. There's a little more to it than that. I made a video about it. Decrease EMF, avoid EMF to the extent that you can. But anyways, the reason I made this video is this is extraordinary news that potentially with something as cheap and widely available as sunlight and incandescent light bulbs, people can improve mitochondrial function and hopefully improve. Okay, that's a big deal. A lot of people are really sick. Okay, here's just one more picture showing the benefits of sunlight. You set your circadian rhythms by getting some sunlight in the morning. You increase your mitochondrial function by getting that red and near infrared light, which is a part of the sunlight spectrum of wavelengths of light that are shined on people. Actually, most of the sunlight is red and infrared light. That's big news. What it's basically saying is most light from the sun is beneficial. Another cool thing about it is the longer wavelengths have more ability to penetrate the atmosphere and to penetrate your body. And what that means is even when it's a cloudy, overcast day, you still will get a lot of red and near infrared light from the sun. So you should go outside, even on a cloudy and overcast day. I didn't know that until recently, but I've been studying a lot of stuff about how light works and how it affects the body. We know from before the sunlight will increase nitric oxide precursors from our skin, subcutaneous tissues to go into the arteries and cause systemic vasodilation. That's partly why you feel good when you walk out in the sun. It opens up your arteries. We know it increases sulfation of the glycocalyx, increases easy water. That's, the gel phase of water. This is like the work of Seneff and Pollock, okay? Anyways, let's see if I got any more slides here in this talk. Oh yeah, and what does it all come down to? You want to be like Adam and Eve, but keep your indoor heating and plumbing. What did they do? Like I said many times, they ate plant foods. Genesis 1:29, I put plants on this earth, they'll be food for you. They walked around in extended social groups, active with their family, okay? They respected God, they were religious. And then the other thing that I wasn't aware of until recently was that sunlight that they're getting is improving their mitochondrial function. And in animal studies, it produces increased aging. Okay, that's all I got on this one. I hope you found that helpful.